Jhpiego is an affiliate of Johns Hopkins University. They are committed to working with international partners to improve the health of women and their families.
In Afghanistan, it is critical that we had to look at what health workers were available and how to help them learn the latest skills, the most important information so they can save their own women and newborns. In Afghanistan, we have been working very closely in establishing midwifery schools. We're helping them to go back to their remote communities and take care of women so women don't die.
Afghanistan faces many challenges in women's health after 23 years of conflict.
Our main and big challenges, the first of them is high infant mortality and under 5 mortality rate. The second, high maternal mortality ratio. And the third, elevated level of malnutrition and high incidence of communicable diseases. This is the fourth. And also inequitable distribution of quality health services, low capacity to implement health services, especially a lack of female health workers, and also low access to health services among population. And the last one is high prevalence of mental disorder.
Since 2002, Jhpiego, with USAID funding, has partnered with the Afghanistan government to develop policies and strategies to improve maternal health and infant mortality.
Jhpiego helped the Ministry of Health to develop training curriculum for in-service training of essential obstetric care, and also Jhpiego conducted many trainings in different parts of the country for healthcare providers.
Hadi Suhairi is a Jhpiego-trained midwife working in Taliquan in the Takar province.
The most common complications I see are hypertension disorders, postpartum hemorrhage and eclampsia. When I started at this clinic, there were 2 to 3 deliveries per month, but as word spread that there was a midwife in this clinic, the number of deliveries increased to 20 to 30 per month on average.
I
came to the clinic because my last baby died as the delivery was done by unskilled birth attendants. This time I heard about the clinic and the midwife from my neighbours and friends. I've come here and I hope that I will have a healthy baby delivered by professional workers this time around.
So I think just hearing the work of Hadia, she shows that she's a real testament to programs like the Community Midwifery Programme and the work that Jhpiego and its partners in USAID is doing. The skills that she's learned in her training, the ability to manage complications such as postpartum hemorrhage and eclampsia, she's developed her confidence, she's become a more assertive woman, and that's very important in a country like Afghanistan where women aren't key decision makers. And in her own way, working with the community, she's really raised the profile of women and the importance that a midwife can play within the community.
If you mention Jhpiego or Johns Hopkins, there's a certain prestige along with it. The kind of technical expertise that these people bring to the program, they bring it from the United States, the know-how and things that we've learned in the United States, but they also take from the best that's available in the local country. They engage really closely with the local ministries of health, and then they hire people who are experts in their own country to interpret the kind of culture and policies that need to be carried out to be successful in the programs.
It became a crisis point when we knew that we had to help women to be educated